All or nothing day. Can you hear me? Check 1, 2, 3.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lang. Sponsored by Lang Eye Institute and Fortifeye Vitamins. Dr. Lang is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lang.
All righty. Good morning and welcome to Ask the Doctor or Ask the Doctors. It's me, Dr. Michael Lang, and Dr. Susan Somerton hosting this show since April of 1993. So if you're new to the program, who's Dr. Lang? I'm a board-certified optometric physician. I'm a certified nutritional specialist, founder of Lang Eye Care and Associates, the Lang Eye Institute, and Fortifeye Vitamins. Like I said, we started hosting Ask the Doctor April of 1993. It's now the longest-running live medical talk show in the country. And like I said, this is live, so no matter how simple or complicated your questions are, you can call and ask, and either myself or Dr. Somerton should have the answer. If we don't know it, we will do the research and get back with you. So I'm going to give you a live call-in number first. It's 813-282-8283. And I think this is the last week of July, 2025. So we are live. Well, we're broadcasting from Salem Media here in beautiful downtown Tampa Bay. One more time, the phone number is 813-282-8283. And if you're watching us live video streaming, because you can see globally, we're live video streaming all over the world, and we're coast to coast on the Ask the Doctor Radio Network. I'm wearing a cowboy hat, and I'm from New Orleans, so I'm not the biggest cowboy, but it is National Cowboy Day. So we want to shout out to all the cowboys and cowgirls out there. It is National Cowboy Day, so we're celebrating that at Ask the Doctor this morning. Anyway, I want to welcome Dr. Susan Somerton. Good morning, Dr. Somerton. How the heck are you?
Good morning, Dr. Lang, and good morning to all our listeners out there. And you are the man of many hats, and that's the cowboy hat today. You got your radio show host hat on, the Fortifeye hat on, and yes, National Cowboy Day. And I believe it's also all or nothing day too. So we're here all or nothing to go in about your health and nutrition and your eyes, and we're here to help in any way we can.
And I just want to mention last week we were live. We did something a little bit different, a little bit unique. We were actually live from the FOA, the Florida Optometric Association, and that was at Universal Studios, the Lowe's Sapphire Falls, a really nice hotel. and we were live from the convention center, and we pulled it off, I think, pretty good, didn't we, Dr. Somerton?
We did. I believe that's the first time we've been out of the radio station and be able to broadcast live and take callers at the same time. So we were pretty excited to share that from our conference that went really well. We were showcasing it from the exhibit hall where Fortify was amongst the many over 100 vendors there, that letting doctors know of new product available, technology, and the continuing education that we get every year so we can be just come better each day and share the knowledge that we learn.
Yeah, we had quite a booth, quite a turnout at the Fortify Vitamin booth. More and more doctors every year are trying to get in tune with nutritional intervention and nutritional wellness to help their patients. So we were quite busy. I have to say it was one of the best conferences we've had in a long, long time. And I'm going to toot Dr. Somerton's horn because she was one of the lecture doctors there, and she put on one of the best lectures on nutrition that I've seen. And I've been in this business for a long time. So, Dr. Summerton, everybody enjoyed the lecture, and you touched bases on a lot of things that doctors need to be aware of. And that's what it's all about. That's what this show is about. That's what you on the lecture circuit and all the things that we do is to try to educate not only the public, but the doctors as well.
Well, thank you very much. And it is important that we continue learning, and nutrition is both of our passions. And we love to get other doctors on board so that they can also help their patients all across the country.
All right, phone lines are open, and I'm going to try to determine how I can see the callers. There we go. Now I see how we see the callers. We're getting ready to take a call in just 1 second. Phone lines are 813-282-8283. Let's go to Robert in, I don't know, Mount Harmon. Robert, good morning. Thanks for holding.
Good morning. How are you?
All right, and yourself?
Good, good. I've got early stage Parkinson's, and I'm wondering if there's any nutritional advice you can give me.
Wow. Okay. So that's a good question. Let me ask this: what kind of job? What have you been doing all your life? What has your main job been?
I'm actually a physician.
All right. So, are you in? How much do you weigh? How tall are you?
I'm 5'7". I'm kind of thin. I've lost a lot of weight. I'm about 140.
Right. So, all right. So obviously you're not overweight because one thing is, I mean, there's some evidence about any type of neurocognitive disease process that ideally getting to your ideal body weight. I mean, some of the things that I preach on this show all the time are obviously eating, plenty of organically grown fruits and vegetables, doing some form of cardiovascular exercise to increase circulation, especially to your brain and lower extremities. I also like a couple of supplements for any type of condition, neurocognitive condition, like omega-3, all right, and curcumin. Um, and these two things, but in moderation. You don't want to overdo it. So something similar to Fortify Super Omega, something similar to Fortify Next Gen Curcumin. Obviously, following your physician's advice. There's some innovative new drugs out there for it, and I like a holistic approach. Obviously, trying to make sure you do not have a vitamin D deficiency because most of us do. And if you live in Florida, then we can all go out in the sunshine, get a little bit of sunshine. Don't overdo it. Don't get sunburned. Put minimal clothing on. Go out for about 20, 25 minutes or 30 minutes, 15 minutes on both sides. Vitamin D deficiency is a root cause of many diseases. Um, Dr. Somerton, you want to add to this? Because there's a whole host of other things we could talk about. And I've got a list of things, more of a natural approach for Parkinson's at home that I could actually email you. But Dr. Somerton, you want to chime in on some other things?
There is, and there's actually two studies that I came across this week that I found very interesting. The first one was living by a golf course, which, of course, here in the villages, that caught my attention. But they did find if you live by a golf course within less than a mile, they did a study and it increased your chance of Parkinson's by
Wow.
126%. which is huge. And so they were trying to correlate why this would be. And of course, pesticides is a possibility that can aggravate or maybe turn on something related to Parkinson's. It could have been drain off of all kind of the phosphates and the chlorines that are in the water from a golf course. But searching for toxicity is definitely something that's going to be up and coming in Parkinson's. And then the second thing that interested me was my friend Dr. Perlmutter, he from Naples, he's a neurologist, and he was talking about the latest research on nicotine and Parkinson's because another surprising study is they found smokers have a 70% less chance of getting Parkinson's. So that's they're researching into nicotine and how that can possibly help the Parkinson. Now, this is all new, so it's something you have to discuss your doctor with, but they
Right.
are talking about doing clinical trials, and I believe they've actually even started it, of using nicotine patches for the early stages of Parkinson's.
And Dr. Somerton, the study on the golf courses, wasn't that also having to do with drinking the water that is potentially well water that's near the golf courses too?
Right, thinking they'd have the runoff from
Right.
all the what they put on the golf course to keep that grass looking nice and healthy is not necessarily draining into us becoming nice and healthy.
Uh, Um, I read a study recently on ivermectin. Have you heard anything about it at all?
Well, ivermectin was really big along with Plaquenil and hydroxychloroquine during the pandemic.
Right.
I'm not aware, and then again, I don't know everything. Dr. Somerton might be aware of ivermectin and Parkinson's. They're finding more and more great benefits from ivermectin, and it is also relatively safe. But I'm not aware of that. But I want to give you my email because I have some stuff on my desk that is almost it's a natural approach for Parkinson's that goes into it a lot more detail. So, and I can
Okay.
email that to you. I'm going to give you my email.
Okay.
So it's
Thank you.
idude92 at iCloud.com. So I'm going to spell it out. EYE. So dude, like, hey, dude,
Yeah.
DUDE 92, and then at the letter I, so iCloud.com. Just shoot me an email and say, hey, I'm the guy that asked you about Parkinson's, and I'll send you a whole bunch of stuff that is more or less a kind of a holistic, natural approach to it that at least educate you and put you in the right line.
Thank you, doctor. I went to medical school in the 80s, early 80s,
Right.
and our nutritional instruction was pretty lacking back then. So,
Yep. But keep the
behind
faith,
the times.
you're still young, so we'll
Yeah, I'm
see.
63.
Yeah, like I said, you're just getting started. And we're the same
Yeah.
age.
Okay. All right. Well, appreciate your advice.
All right. So shoot me that email.
I sure will. Thank you again.
All right. Take care. Wow. Dr. Summerton, I wonder what everybody in the villages is thinking right now about the whole golf course Parkinsonian deal. Huh.
Right, we've got so many golf courses here, which we love people to get outside and go play golf and get some sunshine and that social interaction, all of which does help you live longer, but it is definitely concern with Parkinson's.
Yep. And so, let's talk about something else. I mean, especially with neurocognitive disorders and even macular degeneration and inflammation, I mean, autoimmune conditions, there is a supplement. We had a caller last week call about some negative adversities to a supplement called turmeric and or curcumin. And, really, all the studies that I've seen that use, really good forms of curcumin that do not have black pepper extract. Remember, black pepper extract, piperine, is a way to make curcumin absorb a lot better. But we've known for many years that it can disrupt the microbiome, it can cause mucosal irritation. And now we know something else that if you're taking turmeric or curcumin supplements containing this black pepper extract, it may be associated with liver issues, hepatitis, and even jaundice. So maybe that's what the guy had called last week regarding curcumin and turmeric. And the supplement that we've actually developed is called Next Gen Curcumin by Fortifeye, and it uses the only oleoresin food grade curcumin, has no black pepper extract, no piperine in it at all. And there's some pretty amazing studies out there showing the benefits of this type of curcumin. Remember, it's a food grade oleoresin. It decreases levels of pro inflammatory interleukins, tumor necrosis factor, even arachidonic acid, nitric oxide synthase, even C-reactive protein, which is CRP. So when you combine that with a good omega-3 as well, it's kind of the double whammy of fighting inflammation and actually improving circulation. And from an ocular standpoint, curcumin is amazing for patients with chronic uveitis or iritis. And I've been using it for 20 years for those patients. These are patients that have this chronic inflammation in their eye. And you know who you are. Your ophthalmologist or optometrist has had you on just low dose steroid drops for years and years and years. Well, now I see if we put them on next gen curcumin and or a good triglyceride form omega-3, oftentimes they can get off of that steroid. But also curcumin can help the drusen in the macula. It can help reduce beta amyloid plaque in the brain. But it is kind of interesting now that there's a study, showing the potential liver toxicity with a specific type. Isn't that true?
Right, and these were just isolated cases that they did find, so it was pretty rare.
Hmm.
But when they did kind of look deeper into it, the cases had been taking with the black pepper extract, that piperine in it, that we know too much of that can inhibit the liver enzymes that detoxify other substances. And so it really came down to what else is in the product besides the turmeric that was causing the problem. But as always, if you have any liver conditions, you do need to check with your doctor before taking it. But the benefits of the curcumin are well documented. We've got so many studies that say how its anti-inflammatory, antioxidant benefits are just very powerful. And so again, we're trying to do the research out there. We know it's overwhelming when you go to the store and you see all those supplements. We want to make sure you're getting the quality of supplements that we can really make a difference on the overall health.
Right. So check out one called Curcugen. That's what we use in our next gen curcumin, Curcugen, and it is like 59 times more bioavailable than the gold standard BCM 95. So check it out. It's called Curcugen, or just go to fortifeye.com and look at next gen curcumin, and that's fortifeye.com, Fortifeye, fortifeye.com. I'll give you the phone number for Fortifeye vitamins. I'm going to give it to you twice. It's 866 503 9746. That's 866 503 9746. Also, those dry eye sufferers out there, which there's a ton of you listening to this program. I mean, Florida is the capital of the dry eye patient. All right. And that's because we all retire here. Well, curcumin is also very good for dry eye. So, a whole host of, potential benefits for the eye and general health. All right, we're getting ready to go to the phones, but here's the phone line. And if you want to give us a call, Dr. Summerton, Dr. Michael Lang, you're listening to Ask the Doctors. And the phone number is 1-813-282-8283. That's 813-282-8283. And it's actually Cowboy Mike right now because we're wishing everybody, every cowboy out there, it's National Cowboy Day. And hope you like my hat. And we're going to talk about how lutein and zeaxanthin may decrease the risk of depression in a minute. But first, let's go to the phones. Let's see. I think Steve and Clearwater. Steve, good morning. Welcome to the program.
Well, the gentleman before me that talked about the Parkinson's disease.
Right.
And then Dr. Summerton said the smokers get less of it. Well, the mechanism probably of that is that if you look at the molecular structure of dopamine itself, it's an antioxidant. So when the smokers smoke, they release dopamine because there even seems to be a much less, slightly less Alzheimer's in smokers and slightly less other type of neurodegenerative disease. It's nowhere near as strong as Parkinson's, but there seems to be the whole brain benefits. Now, you say, well, obviously you don't want to start smoking. to help your Parkinson's. Obviously, you're causing one problem for another. So how can you put in your body something that will have the effect of smoking? And if you put in, if you add fat soluble antioxidants, they can oftentimes help the basal ganglia recover. In fact, when I had my encephalitis, I told you about 30 years ago in 1994, I had a lot of basal ganglial damage. And contrary to scientific belief, I've been able to get all that damage healed. So I would think that if you went on a period years long, maybe 3-4 years, where you were really good to those basal ganglia cells and the substantia nigra in the basal ganglia, those cells could actually recover. I don't think it's an irreversible disease. I really don't. I have no authority to say that, obviously, but in my case, it was.
Well, if anybody can figure this out, you can. It's Genius Steve. They can't even measure his IQ.
Well, you know, obviously that's overlaid. Don't confuse being informed with being intelligent. I think sometimes people think I'm smarter than I really am just because I'm informed, and it makes you appear to be more intelligent than you are. You know, I mean, you see that in a lot of news anchor people. You know, they sound so smart.
Right.
But that teleprompter can make anybody
You're still pretty intelligent, Steve. And we always enjoy your questions and your replies.
Yeah, but the thing about the blood-brain barrier is it's sometimes difficult to get antioxidants into the brain, and I would think that the fat-soluble antioxidants like astaxanthin and vitamin E would be more potent than maybe coenzyme Q or something. But
Sure.
that's just a guess. The more polar the molecule,
and also, you do bring up, we should have Dr. Karen Heck on very soon about cognitive decline, neurodegenerative diseases, and even Parkinson's for carotenoids like astaxanthin, lutein, zeaxanthin isomers, because all these carotenoids cross the blood-brain barrier, and even acetylcholine, which is the patented form or trademark form called cognizine. So, all of my patients that have any type of cognitive decline, I do recommend our product called Fortifeye Focus and Brain. And I always tell people, my mom, I swear it's reversed her dementia. Betty Ruth McFadden Lang is almost 98, going strong. And I always tell people when she started to live with me 7 years ago, she would come to the breakfast table. And remember, we live on the bay and the lake, so there's water on both sides of our house. And she would literally be sitting at the table and think she's on a cruise ship. When's Captain Stuving from the Love Boat going to sit down with her? And now, after being on Focus and Brain for about 3 to 4 months, I mean, she's sharp as a tack and doesn't think she's on a cruise ship. Now, maybe it was a little bit better before, thinking she's on a cruise ship all of her life. But
yeah.
Anyway,
you took her dream. You took her fantasy away from her. You're very cruel.
All right, Steve. Hey, thanks for the call.
One thing you can do is a lot of people who take cholinergic stimulants like acetylcholine or acetylcholine.
Right.
The problem is they're taking the choline portion, but the body has to make acetylcholine. And it becomes, if you're taking like acetylcholine or any of those cholinergic stimulants, if you take a little vinegar, that will supply the acetyl groups to make them more the acetylcholine more effective.
Right.
And vitamin B5 is what's necessary to bind the acetyl group to the choline molecule, and that works. A lot of people have really gotten benefits from taking a little bit of vinegar and some vitamin B5 pantothenic acid.
All right, Steve. Thanks for the information as usual.
Okay, God bless you.
You have a good one. And Dr. Summerton, let's chime in a little bit about lutein and zeaxanthin and, how it can help potentially reduce depression. This is a relatively new study with quite a few people in it.
Right, and that's kind of what Steve was touching upon about which nutrients can get into the brain. And the brain is pretty picky about what nutrients it lets in. And we know that lutein and zeaxanthin that we talk about all the time, those are the carotenoids that are found from like your green leafy vegetables. It's also found in like eggs, orange peppers have a lot of it. We talk about it all the time with our focus supplement. our macula defense supplement that has it in. Now we all know for the eye, because it improves what we call that pigment in your macula, to help with prevention for macular degeneration and prevent you from losing that pigment density. But now we know first it goes into the brain. The brain is going to take what it needs first, but it's going into those regions of kind of emotional regulation and cognitive function and thinking. It's like your prefrontal cortex and the hippocampus there. So those individuals that they looked at, when they had been eating and consuming and taking lutein and zeaxanthin supplements, they had a 42% lower chance of depression. So that's very exciting to us because we recommend these supplements all the time. So now we know not only are we helping their eye health, we knew a little bit on the cognitive function, but now we're also helping that quality of life and lowering that chance of depression too. And we want everybody to be healthier. And of course, now we can find happier too.
Healthy and happy. Nothing wrong with that. All right, guys. You're listening to Ask the Doctors. If you got a question, no matter how simple or complicated it is, we'll try to answer it to the best of our abilities. Remember, this is for educational purposes only, never replaces a medical evaluation or an eye evaluation. Um, so there's a nice little disclaimer. Give us a call at 813-282-8283. That's 813-282-8283. We're getting ready to take a call in just 1 second. So now we've talked about a few things that can actually cross the blood retinal barrier and the blood brain barrier, a few supplements that Fortifeye Vitamins has actually developed. And of course, Fortifeye Focus, which literally thousands, tens of thousands of you are taking, and then Fortifeye Focus and Brain. So Fortifeye Focus and Brain is the exact supplement of Fortifeye Focus. It has the lutein, the zeaxanthin isomers, the astaxanthin, but it has cognizine in it as well, which is a trademark patented form of citicoline. So that is available at fortifeye.com. So check it out, fortifeye.com. And when you combine Fortifeye Focus or Focus and Brain with the omega-3, it's kind of like a double whammy of fighting inflammation and even depression, because there's some good studies talking about the proper form of omega-3 helping with depression as well. So now you got Fortifeye Super Omega or Super Omega Max combined with either Fortifeye Focus or Fortifeye Focus and Brain. So if you're over 60, go with Fortifeye Focus and Brain. If you're in a high stress position, you're on a computer all day long, you're a gamer, go with Fortifeye Focus and Brain as well. And if you're over 200 pounds, go with Super Omega Max. Under 200 pounds, go with Super Omega. All right, we're going back to the phones. Andy has been waiting patiently, so let's retrieve Andy in Largo. Andy, good morning. Welcome to the program.
Good morning. How are you guys?
All right. How are you?
Well, pretty good. I'm calling about my Monday surgery at St. Anthony's, and they said last Monday, they said, now, no Fortifeye vitamins for 5 days before surgery. And I said, I can't go without my Fortifeye vitamins. So what I thought I'm still taking, though, is the whole food superfood, Fortifeye superfood, because I looked on it with my girlfriend Coco, and I said, look, there's no vitamins. It's all whole food. So I just wanted to confirm that, I think.
Right. So that's a good question. And what doctors do, they want to get you off of potential supplements that have blood thinning properties. And that's like, ginger, boswellia root, vitamin E, even omega-3 and curcumin and black currant. So a lot of the Fortifeye vitamins, yes, I would recommend stopping those for sure. And obviously things like aspirin and Aleve and Advil and no booze, no alcohol. Okay. As far as the organic blue-green superfood, I mean, if your doctor said stop it, I'd follow his or her advice. However, it is just whole foods, all right? It's kind of like whey protein. You wouldn't have to stop your whey protein because, that's just a protein. The superfood really doesn't have anything that's going to cause blood thinning. If anything, it's just the opposite. It's got some vitamin K in it that would do just the opposite and help you clot even quicker. So you're probably fine by taking the superfood because they didn't tell you not to eat, right?
Right, and I did take one naproxen sodium last night before bed because I worked really hard changing water filters at a local hotel near your radio station yesterday out in the heat, and I was a sore cowboy. And so is that one just 220 milligrams?
Yeah, don't take any more of that. Just get in a hot bathtub with Epsom salt. All right. Don't take any more naproxen.
Yes.
All right, and good luck. Good luck on your surgery.
Yes, sir. Thank you so much, Mike and Doctor. We appreciate it.
All right, keep us posted.
Thank you.
All right, you're listening to Ask the Doctors, the longest running syndicated live talk show in America. And that's Dr. Susan Somerton and myself, Dr. Michael P. Lang, P for Paul. Give us a call at 813-282-8283. That's 813-282-8283. Also, you can come see us at the Lang Eye Institute in the Villages, Florida. The Lang Eye Institute is a state-of-the-art eye care center. Pretty big building. It looks like a plantation on the Mississippi River. It's right in the heart of the Villages on County Road 101 and 466, across the street from Publix, next door to CVS. And we take care of just about every primary eye care need, whether it's glaucoma or macular degeneration, dry eye. You got a piece of steel in your eye, conjunctivitis. I mean, plus, routine eye care, contact lens fitting. We do a lot of advanced contact lens fitting there as well. So I'm going to give you the phone number for the Lang Eye Institute. It is 352-753-4014. That's 352-753-4014. Also, there's two websites you can go to. That's simply drmichaellang.com. That's drmichaellang.com or langeyecare.com. Also, I'm trying to build the Instagram site back up. Now, remember, there's a lot of fake Dr. Michael Lang Instagram sites. The only legitimate, real Instagram site is Dr. Michael Lang _ It's got a blue check. We've got about 250,000 followers. I'm trying to build it up because I told you all a few years back, somebody hijacked my site and it went away. And so we're trying to build it back up. So you can go to that site. You can like, you can share, you can comment. We do appreciate that. And I answer everybody. I personally answer it. My webmaster doesn't answer it. I do the Instagram. We've got people that do some of the other sites, but I'm the guy that chimes in on Instagram, Dr. Michael Lang _ I don't chime in much on Fortifeye or any of the other sites, but I do on that Instagram. But be careful. A lot of fake Dr. Michael Langs out there. I am never going to text you and ask you to go into a private room. I'm never going to ask you for money. I'm never going to ask you to donate to a philanthropic organization. So beware of that. All right, one more time. Phone lines are open. 813-282-8283. Let's go to the phones. Let's see. I think it's John in Newport Richey. John, thanks for holding.
Yeah, good morning to you. I just want to know how humidity affects dry eyes, because when it's humid, which it is now, I seem to tear up more.
Well, this is a good question, and it's very interesting. I got a quick little story here. I grew up in New Orleans, and so I had a patient not too long ago. Well, and actually it was about 10, 15 years ago, so that's kind of long for some people. And this is before we had IPL treatments and all the treatments for dry eye that we had. And this patient tried everything for dry eye, literally everything. Nothing helped. And I said, why don't you take a vacation, go to the French Quarter in New Orleans, have a hurricane. Now, maybe she had a few too many hurricanes, and maybe that's why the pain went away in the dry eye. But you know what? She lives there now, because remember, the humidity in New Orleans, that's below sea level, it's higher than any place in the country. And so her dry eye actually resolved because of the humidity. So a humid environment is actually good for dry eye, where a very dry environment is bad for dry eye. But, doing some specific things holistically and naturally, keeping your eyelashes clean of bacteria and any type of parasitic flora. So clean your eyelashes when you're in the shower. Heat the eyelids up, a hot washcloth or the hot shower. So we heat them, we clean them, we nutrify the glands with a good omega-3 and black currant seed oil. Or better yet, you get our Fortifeye Advanced Dry Eye Kit, and it has everything in it. And then you use a good lubricant. The lubricants I like are Oasis Tears and Optase Tears. And then I love one called Regenerize. Even that's my favorite. And then if you still have dry eyes, you can go to your local optometrist or ophthalmologist. They can do punctal plugs. They can do amniotic membranes, or better yet, something Dr. Summerton and I are going to talk about in a minute is called intense pulse light therapy, which is amazing for dry eye. Um, Dr. Summerton, you want to chime in a little bit on the whole dry eye humidity issue?
Right, and I agree with what you're saying. We're more familiar with the humidity helping the dry eye than hurting it. But I remember just there was a study that said 40 to 60% humidity is optimal for dry eye. So, of course, in Florida, we're way over that on a daily basis outside. But I do find that that can worsen the allergy part of it. We're sweating more. It can increase the blepharitis. That's where you get the inflammation around the eyelids that the what you're talking about, the wipes and the warm compresses can help. So it could be looking at something else. Do you also have blepharitis going on? Looking around those lashes to help that as well.
Okay, all right. I appreciate the information. Thank you.
All right, John, you take care.
Yes, you too.
And I remember when I used to get sick, my mom used to put a humidifier right by the bed. Huh. I haven't used a humidifier in years, but I do sit in the I do sit in the steam room, and
Well, we can just go outside and get it.
right, and the steam room does help your dry eye. So steam also helps open up your lungs. If you go into steam room, put some eucalyptus oil or peppermint oil in there, and that helps open up your lungs, helps you breathe better. But the steam will help open up the meibomian glands. And Dr. Summerton, meibomian gland dysfunction is a big problem, especially in the villages. The older you get, the more clogged your meibomian glands tend to get. And we're going to talk in a lot more detail about ways to open the meibomian glands, because MGD, or meibomian gland dysfunction, is one of the root causes of dry eye that is very difficult to treat. But we got some exciting stuff to talk about, and we are going to get to it at this show, I promise. All right, let's go back to the phones. We're going to go to David in Clearwater. David, good morning. Thanks for holding.
Hi, Dr. Lang and Dr. Sumter. Good morning. Thank you. Doctors, I wanted to ask you, it's a general question. I'm really a fan of the show and all. Do you have, do you ever discuss, I'm sure you do you discuss, what are recommended supplements that, people should take for, daily use if there's not any necessarily issues that you have? And then the second part is really, I take fish oil every day, right? And I take 2,800 units of EPA and DHA, 1,600 and 1,200 respectively.
Mm-hmm.
And I didn't know if that is adequate or not. And then secondly, I do take xanthan, an astaxanthin from it's a generic, so-called generic one. I take 4 milligrams a day. And I was just wondering your what you thought about that approach, Dr. Lang.
Right, so first off, how much do you weigh?
Yeah, so I'm the guy that called last week. I'm the skinnier guy now. So I'm 165.
All right. Do you just have huge amounts of inflammation in your body, or you don't? Do you?
No, I'm kind of working myself in a pretty good way. Yes.
Good. So I think 2,800 milligrams of omega-3 is probably too much. All right. Is it going to hurt you? Probably not. But is it necessary? Also, probably not. We were involved in a lot of omega index studies where we took the blood and tested our patients. And that's how I developed Fortifeye Super Omega. And I found out the lion's share of patients that were under 240 pounds, okay, if they took 2 Fortifeye Super Omega, their omega index went between 9.2 and 11.2%. And anything over 8 is the zone you want to get in. That's the omega ratio in your blood. So we found over 240 pounds, then you had to go to 2,400 or maybe even 3,000 when you're over 240 pounds, but you're not over 240 pounds. Now, here's another caveat with that. If you're taking the typical over-the-counter fish oil, then yes, the 2,800 milligrams is probably adequate. It might not even be adequate, because remember, that's an ethyl ester molecule, has ethanol attached to the backbone. So it's very inefficient, absorbs very poorly, has to go through your liver every day to cleave off the ethanol and replace a triglyceride backbone. So it's very inefficient, very unstable, goes rancid very quickly. So my recommendation is going to a re-esterified triglyceride form, and that's like Fortifeye Super Omega, and there's a couple of other good brands out there. But the lion's share of omega-3 has ethanol attached to it. I mean, I'd say 95% of it, so it doesn't absorb well. So not just to push my product, but if you did the Fortifeye Super Omega, all you need is 2 a day, and you're in a zone that's been clinically studied. As far as
Thank you.
a
Super Omega.
multivitamin goes for overall health, remember, a vitamin is a supplement, all right? It's never to replace your food. So I always recommend eating plenty of organic fruits and vegetables, plenty of good protein, obviously avoiding all the garbage that's out there, and getting off the typical SAD diet, the standard American diet. And then you don't have to supplement as much. But if you want an insurance policy, okay, because none of us really eat perfectly. If you want an insurance policy, I did develop something called Fortifeye Complete Advanced Nutrition. And this is a multivitamin slash eye vitamin with the latest of the latest of the latest. It's evolving. It's the 17th revision in 20 years, and we'll constantly evolve it. And you would take 1 to 2 a day with food. And remember, this is kind of an insurance policy. If you look at the website, fortifeye.com, and just go to Fortifeye Complete and look at the ingredient profile, and we thought this out. So there's no beta carotene, there's no vitamin A in it, because these can block the absorption of carotenoids and vitamin D. And there's nothing in it that has a lot of blood thinning properties and nothing that's going to cause like gastric distress. So it's evolved. And then there was a third part of your question. I forgot what it was now.
Oh, no problem. It was astaxanthin, 4 milligrams a day. Do you think that is I can up that, increase that?
Yeah, astaxanthin is a great supplement. So 4 milligrams a day is better than nothing. But I think most studies are showing anywhere from 6 to 12 milligrams of something called astereal astaxanthin. It is the most clinically studied astaxanthin on the planet. So an example is I take 2 of the Fortifeye Focus and Brain, and it has 6 milligrams of astaxanthin. So I'm getting 12 milligrams of astaxanthin. So anywhere from 6 to 12, but 4 is certainly better than the lion's share of the public. And astaxanthin is one of those great supplements that I recommend everybody should take. Astaxanthin, omega-3, creatine. Those are 3 of the really hot supplements out there. But yeah, I would continue taking that or doubling it. You could double it and go to 8 milligrams.
Oh, thank you, Dr. Lane. I'm going to go to your website. I appreciate all of your insight. I want to, super cool. Doctor, I have a little thing, just real quick. I had this issue with cardiac issue 20 years ago. I was one of those guys that flacked up like crazy. I had to get bypass surgery at 45. Isn't that horrible? So I was super sick. And so I got better and I worked after surgery. And so I think, my cardiologist always pushed high level. He was pretty innovative at the time, high amounts of fish oil.
Good.
And so maybe that's why I'm kind of in that zone. I've been of that super high amount,
Sure.
because of my cardiac issues are really great. I'm under control, and I'm my doctor. My cardiologist always sits back and lets me talk about what I do. I have a kind of unorthodox approach. I don't take a lot of meds for cholesterol, and I eat I don't want to burden your show listeners with my thing, but I have a different gig, but supplementation, right. I'm always interested in learning, and you're very smart people. So I'd like to thank you very much, Dr. Lane.
Well, thank you, and good for you. Congratulations. You're turning back the clock and you're reversing the aging without medications. So congratulations, and keep us posted on your future, all right?
All right, thanks. Bye-bye, everybody.
Bye-bye. All right, so we're going to talk with Dr. Somerton now about meibomian gland dysfunction, a big problem with our patients and with everybody's patients in Florida, or quite frankly, when you just get older. The meibomian glands are little glands along the lid margins that get clogged. When they get clogged, your eyes get very dry. And this is something that we treat on a daily basis. And Dr. Somerton is going to expand on, how we can treat this.
Yeah, and we're talking about going to these exhibits and going to the conferences and looking at new technology. Well, a while back, you and I had discovered at one of these conventions the latest and greatest for what we call intense pulse light therapy for dry eye. Now, there is a lot of different versions out there of it, but in particular, we were concerned about not only it being effective, but also very safe. And so we actually decided, and we purchased it a while back, the Optilight by Luminous. And the reason being that's the one that is FDA approved. And so we want to make sure it's using pulse light, and they're unique for that. They have this safety mechanism in it so that we know when we're treating patients, we're having the effect of targeting the root cause of dry eye in a safe way. So we're using it for what we had talked about, those meibomian gland dysfunction patients, where those are the little oil glands that are on the upper and lower lid. Every time you blink, it should release a little bit of that meibomian fluid, that oil lipid, into your tear film, and that prevents it from evaporating. So this intense pulse light technology targets with there's 4 treatments, and we're going along the underneath your eyes that's using anti-inflammatory mechanisms. So it's going to reduce the inflammation. And this is shown with clinical studies. They actually check what we call the inflammatory mediators after they've have it done, and it does lower it, and it's going to restore that meibomian gland dysfunction. So it's going to liquefy all that hardened kind of meibum in there and allow it to secrete. And we actually see this after we've done the treatment. About 2 of the times we'll actually express the glands, and we can see it under the microscope. And I mentioned yesterday to a patient, it's so fulfilling when you squeeze the lids and you see that oil come out, because you know that patient's going to feel better. And when they have a smile on their face, that just really makes our day, because dry eye patients can be pretty miserable. And so this is another way, another tool that we can get to that root cause. If we can get those meibomian glands working better, we can stabilize the film. We can get clearer vision, because one of the symptoms of dry eye is also blurry vision. If you don't have that smooth tear film, you're going to be blurry. And so 4 treatments we do, and it's usually about 2 weeks apart, and we're just seeing fantastic results with that intense pulse light therapy.
And I agree. Amazing results. I mean, I've had patients that I've been seeing 20, 30 years that have just lived with chronic dry eye, and we've tried everything. And it wasn't until we did the intense pulse light therapy, the Optilight IPL, that they really got the symptomatic relief that they wanted. So if you are plagued with dry eye, if you have chronic dry eye, you've tried everything. You've tried Restasis and hot compresses, you've had LipiFlow, you've had iLux, you've done punctal plugs, you've tried everything, and you still have eyes that feel sandy, gritty, burn, tear, itch, fluctuation in vision, even pain, some severe pain. Ask your eye care provider if you're a candidate for intense pulse light therapy. And I do recommend finding a provider that has OptiLight, because it's the only one that is FDA approved. And we have the only one in the villages. So we sort of have a monopoly on it. Certainly come by the Lang Eye Institute, and you can see Dr. Summerton or myself for OptiLight treatment. It's painless. It takes about, you're in the room 15 minutes. We've done hundreds of these. Nobody's had a problem. There's also a little bit of an aesthetic benefit too, which isn't bad. It kind of rejuvenates the skin, helps rebuild collagen, helps minimize fine lines and wrinkles. So there's an aesthetic component to it as well. So check it out. It's called OptiLight, made by Luminous, and we do offer it at the Lang Eye Institute in the villages. Also, since I just mentioned something about aesthetics, let's talk about something called OneSkin. OneSkin is a new generation skincare line that is pretty amazing. They have an eye cream and a face cream, a UV, a whole body cream, and a cleaner. You can get this skincare product now called OneSkin at fortifeye.com. Just go to fortifeye.com. You can get it at the Lang Nutrition Center in Ocala, the Lang Eye Institute, and you can get it at the Fortifeye Nutrition Center. So, we've used Obagi, we've used SkinCeuticals and all sorts of products over the years in our oculoplastic centers. And now we're finding, thanks to Dr. Summerton, that OneSkin works better than anything. And you got a minute to talk about this because you've been using it and you've been getting some pretty good results, Dr. Summerton.
I have, and just like a lot of people out there, I'm sure you've spent hundreds, even thousands of dollars on skin creams. And I was super excited to find this one. And it contains a particular peptide that was discovered to be able to actually penetrate into the dermis. So you can be using a lot of products out there that they don't get deep enough to have an effect of that anti-aging that we're looking for. Well, the neat part about this, they even tested it on when they do the blepharitis, not blepharitis, the blepharoplasty surgery, and they remove that extra skin. They have all this extra skin that they can take to the lab and see if these products work. So this OS1 peptide that's in OneSkin was able to be proven in human skin to penetrate it and have where it helps retain that collagen and it decreases those wrinkle causing enzymes, which then improves that skin elasticity and improves kind of the structure of the skin. It also strengthens the skin barrier, locks in that moisture, and gives you that overall better texture, kind of more radiant skin, more hydrated. And that improved elasticity. And we just love it. I love it. I use it every day. I use it twice a day, actually. And we love patients getting the benefit from it too.
And also, there's a OneSkin travel kit, and it's a deal. It's only $136, free shipping. It's TSA friendly packaging, and it comes with face, body, eye, and prep. Everything, only $136. It's called OneSkin Travel Kit. It's at Fortifeye.com. With that, I want to thank everybody for tuning in and listening to Ask the Doctor. And remember, if you're not happy with the eye care you're getting, get a second opinion. Have a great day. God bless you, and God bless America.